you have 2 stations for each station. How? Okay. So you have a preparatory station and you have the station itself. The station itself could be patient relative, patient, hungry patient, Zoom call, video call, conference call, Teams call, normal call, whatever. We don't care. Okay, whatever will deal with one scheme. In the preparatory station, you have notes and you go in this room for 9 minutes. Okay, I'm sitting here. I'm reading the notes. Okay, first they will give you who are you, where are you, and who are you going to talk to regarding who. Okay, so I will have my notes. Empty paper and pen will be provided, like in history taking. Then you write, I am blah blah blah, blah blah blah, I am talking to this, and this should be in 1 page for you not to lost. Then on the second one, you need to write about the patient. Why you are talking to this consultant, and in details, all bloods, background of the patient, you need SPAR full. You need background of the patient, situation, background, assessment, recommendations. Okay, look, write SPAR. Okay, situation, this patient is a 44-year-old gentleman coming with acute limb ischemia. Okay, background, post-medical and COPD and diabetic type 2. And he's got hostile abdomen. He has done acute laparoscopic, acute lab coli before, lab coli. And he did, like for example, hernia repair twice, recurrent hernia repair on this because it was not lab coli, it was open. So you need to write background of the patient, no other comorbidities, and then background, my assessment on examination and radiology and results. On examination, 1 to 3, and examination findings and this bloods. B, background, assessment, what I have done for this patient in assessment. I give 1 to 3 as well, so assessment and management, and then recommendation. I want to refer to vascular unit. Excellent. Then I will go out, 9 minutes finished, I will take this paper with me, I left the notes of the patient, and I will go in my room. Curtain, another consultant sitting, and a phone simulation. Hello, when you talk, you need first to talk confidently but politely, humble but confident. Okay, like don't say hello, hi, don't be afraid. He is your consultant, he is your friend, he is very nice, don't worry. Okay, I know from history you are worried, but don't worry, it's okay. So hello, hello, good evening or good morning. I am 1 to 3. Can I confirm I am talking to 1 to 3? Okay, so good morning, good evening. I am Rida, working in as ST3 in Northampton General Hospital regarding acutely unwell patient. Can I confirm that I am talking to the vascular consultant in blah 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 hospital? Yes, you are talking. What are you coming for? Okay. Thank you, sir. I'm talking today regarding SPAR. A 25-year-old or 44-year-old female male gentleman who presented to our hospital in Northampton with 1 to 3, and so this is the situation and the background of the patient, post medical history, and blah blah blah. And on my assessment, you can say it's about form. On my assessment, we found on history showing blah 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 in background, and in assessment examination showing 1 to 3. And I requested full blood count using these, which show with patient is total leukocytic count is high, CRP is trending high, and also the lactate is 4, and he looks septic. He immune score of 5 for respiratory rate of 20, blah blah blah. Okay, and we requested CT angio, which showed acute limb ischemia. Okay, you finished. Background already, you told him about past medical and surgical history and comorbidities, and here assessment, then recommendation. And now I'm calling you, sir, for 1 to 3. Okay, but we have no beds. You should show alternatives. You are registrar. You should tell him, okay, I need to talk to the ITU registrar to step down some patients, to go to another if they are wardable, and talk to the ward team if they can downgrade any patient in hubs, high observational base to ward, and this, like this. Okay? And also I want to talk to the booking team, to the bedside site manager, like this. Okay, good? Good. Okay, but what about this patient? You told me that he's hyponatremic and hypokalemic. How you managed? Yes, of course, we manage that. We stabilize the patient. You simulate. You are in a movie, so you simulate. We have spoken to the renal team because he's severely hypokalemic or severely hyperkalemic, and we have spoken to the medics, and they for this hypokalemia they gave 40 millimole per liter KCl over 24 hours. Excellent. Okay, so you manage. And patient is known to have AF. I have spoken to cardiology and medics and also hematology regarding anticoagulation and reversal. Okay, whatever. Okay, AF, ECG, echo, if elective, and we said if